Good afternoon. I'm still reporting on the cure. On Friday, Dr. Richard Bartlett, MD, from Odessa, Texas, appeared on America Can We Talk with attorney Debbie Georgatos on Real News Communication Network, RNCN, in Dallas, Texas. Dr. Bartlett has been practicing medicine in Texas for 28 years. When the COVID-19 outbreak began, he noticed that his patients were becoming critical due to a rapid inflammation of the lungs, and so he tried a legacy steroid on patients, and one after another it seemed to work. In fact, it worked every time he tried it.
And to put things in perspective, let's look around the world. In the country of Taiwan, there's over 25 million people. They're stacked on top of each other. If they did social distancing, they'd be out in the ocean floating around.
Yeah.
There's not enough room for them to do social distancing. But guess how many people have died to date during the whole pandemic in Taiwan? 7. As many people as you can stack in a minivan going down Central Expressway. It's the situation also in Japan. 121 million people in Japan. They've had less than 1,000 people die during the whole pandemic. Singapore, only 12 people have died in the whole country during the whole pandemic. Well, that's not possible according to what we're being told in the mainstream media, but that's reality. Anyone can look it up. You can even look at the Johns Hopkins COVID website and you'll see those numbers. They're hidden in there, but I'm pointing them out because the people in Texas need to hear good news. They're doing what I'm doing, which is not hydroxychloroquine, although that works. So what they're doing is an inhaled steroid. And so my silver bullet is inhaled budesonide. The brand name originally was Pulmicort, now it's generic. It's super cheap. It's about $200 for the total treatment if you pay cash. With insurance, many of my patients are not even having to pay for it. And you use a nebulizer machine. It's an asthma medicine. It's a respiratory anti-inflammatory for COVID, which is a respiratory inflammatory disease. And it works. 100% of my patients are alive. I've been treating this since March. And you use it for 5 minutes. It takes 5 minutes to do a breathing treatment. You plug it in the machine in the wall. You put the medicine that's pre-mixed, pre-measured from the pharmacy into the little reservoir. You push the on button and you breathe it during 5 minutes during the commercial.
You just have a mask on your face and breathe.
You don't even have to have a mask. You can use a little mouthpiece that you hold in front of you.
The results in some people occur within minutes.
They tell me, I feel better during the first treatment. And so their chest pain goes away, their shortness of breath goes away, their fever breaks. I'll give you an example. I have a patient who has 2 kinds of cancer. She calls me after 5 days of being flat on her back in her house in the bed, can't get out of bed, fever won't break for 5 days. She says, I heard you on the radio, and would you please help me? It's on a Friday. She says, my granddaughter tested positive today, and I think I have it. And I said, I'm sure you do with all the symptoms you're describing. She is currently fighting 2 forms of lymphoma. She's on chemotherapy right now. She just had radiation a month before for the lymphoma. She should die according to what you hear from the CDC and World Health Organization. But I gave her that treatment that night. In the morning, her fever had broke. She had her first good night's sleep. Over the weekend, she recovers. On Monday, she works an 8-hour day. She still is fighting cancer, 2 forms of cancer, but she's cured of COVID. She's symptom-free. She has her 2 consecutive negative tests. That's a cure.
Dr. Bartlett says budesonide or Pulmicort is super safe.
Preschool kids use this. It's safe. It's so safe. It's been out for over 20 years. It's been used on 2-pound premature babies safely without batting an eye, and the fragile elderly in nursing homes for over 20 years. There's no reservations with it. It doesn't cause any cardiac risk like the accusation of hydroxychloroquine is a risk of heart trouble. Although that's ridiculous to make that accusation, this one doesn't even have that risk.
Dr. Bartlett gives one of the most simple explanations of what COVID-19 disease is.
But let's talk about what COVID is. It's a respiratory virus that goes into the lungs, binds to ACE receptors in the lungs, and that triggers the release of inflammatory chemicals, and we call it a cytokine storm. That's a fancy word for inflammatory chemicals and enzymes that are released in the total body. And so with COVID, we have a killer that's never been around before. It is killing some people if they're not treated. And so for 50% of the people, they get it and they don't even know they had it. 50% of the people don't even know. But for the 20% that are at risk, there are treatments. We already have an answer. Let me tell you, you're right. Taiwan, 24 million people, they don't need to wait for a vaccine. They don't have a problem that you should vaccinate 24 million people for. They only had 7 die during the whole pandemic. We have some treatment plans and options that are already valid and working.
Dr. Bartlett then explained the low cost of budesonide.
Big Pharma's not going to make a dime off it. Nobody's going to make any money. It's $200 for the total treatment versus the experimental antiviral that you have to be put in the hospital and then be a part of an experiment to get that costs over $3,100 just for the medicine. And then you pay for $15,000 at least to be in the hospital during that time, unless you go to the ICU, and then you'll get $30,000 or $40,000 bill on top of being sick.
Dr. Bartlett then explained that very few people actually need any medicine at all to beat COVID-19.
You know, for the 50% of the people who are going to get it and never have symptoms, they don't need medicine. They certainly don't need a vaccine. But for the 20% that are at risk of death if they don't get treated, we have an answer. And here's what we need to do: early treatment, early testing, early treatment.
But according to Dr. Bartlett, that's not what the CDC recommends. They seem to favor waiting until the patient is really, really sick before their treatment recommendations kick in. He then explained how he came on the inhaled steroids treatment.
In March, I was working a 48-hour shift in the emergency room, and I was distraught. Quite honestly, I was distraught. I'm a Christian, and so I was praying throughout that 48-hour shift. I'd see patient after patient, and I was thinking, God, what am I going to do if someone comes in here with COVID and they're dying? They're going to trust me to do the right thing for them, and I don't have an answer. President Trump mentioned hydroxychloroquine, and then that got shot down immediately. And so I was praying. I laid down for a cat nap between patients. I woke up convinced that God had given me a winning strategy. And you know what? A week later, I had to try it out on my first 2 patients, and for every patient, it's working. It's what Japan has stumbled on, and what Taiwan has stumbled on, an inhaled steroid. They're using a different one than I'm using. The one I'm using, I think, is better. Inhaled budesonide with a nebulizer treatment. I'm also giving an antibiotic that'll cover walking pneumonia and other pneumonias called clarithromycin. And I also give zinc because that interferes with virus multiplication. But the silver bullet is inhaled steroids.
The reason he uses inhaled steroids instead of pills or an IV is because steroids weaken the immune system. So he just exposes the point of disease, the lungs, to the steroids, and that cuts down on immune suppression throughout the entire body.
The reason I'm using a nebulizer is if you use an inhaler, 90% of the medicine never gets to where you need it. Research shows that.
Oh, okay.
But a nebulizer works.
Dr. Bartlett then explained that the NIH just launched a study of his inhaled budesonide treatment, but in typical millions of Satan fashion, the study is being designed so that it will fail and then it will be released in October just before the election. This is such an unbelievably gross distortion of the spirit of true medicine, the bastardization of medicine for political purposes, that it may even be criminal.
I don't know if they heard what I was doing, but their study will be over in October. But it's set up for failure at the start. And let me tell you how. Early detection and early treatment. That's common sense. That's the American healthcare system.
Sure.
What we're getting is what communist China has forced on the whole world. Don't wait until you're a breath away from death. Wait till the house is burned 2/3 down and then seek help.
This is what NIH is doing, you're saying?
This is what the CDC is telling us to do, and every authority is telling us don't seek help unless if you got mild to moderate symptoms. Wait till you have severe symptoms. I'm getting calls from people who go to the ER because they feel bad, and they're sent home with a positive test saying take Tylenol and tough it out at home. That is the standard of care that's being put out. That's a terrible plan for any health care problem, especially one that can kill you. And for 20% of the people, this is a killer. And we don't know who that 20% is, but if they have symptoms, we have something we can do about it. And last week, the University of Oxford announced that they're going to study inhaled budesonide against COVID. Whether they set the study up for failure, like I feel like the NIH has done, where they're going to wait until someone, the criteria by the NIH is you have to have pneumonia and be in the ICU and be on a ventilator before they'll even give you this.
In other words, they want these cheap legacy remedies to fail, and in doing so, people are going to die. It's so sad, but so true. Then the host asks a very simple question. Why are they doing this? Dr. Bartlett hesitates. He wants a couple of extra seconds to figure out how pointed a response he wants to go on record with.
So why would the NIH recognize what you're claiming? Why would they test it by waiting until someone who's severely ill in the hospital? What is the reason not to test it in the way that you have been, which is early on first symptoms?
Why are we doing anything that we're doing right now, Debbie?
That's not a good question.
I'm just saying, what they did in Italy was social distancing, wear a mask, shut down everything. How did that work? Let's talk about what works, which is what I'm doing, which is what they're doing in Japan and Singapore and Taiwan, and that's early detection. It's good that we're doing mass testing now. I'm telling you, at the ER that I am associated with, they're doing testing now. They didn't have the ability to do the testing in March. We couldn't. We were scrambling to find where we could even send people to get tested in March. The reason the numbers are going up is that we're having 100 times the amount of tests being done right now.
And that's a good thing.
It's a good thing. That's what they're doing in those countries, the early detection. Hey, we do that we don't wait. I've actually done biopsies on people who had abnormal mammograms, and during the biopsy, I've removed the whole cancer, and the person was cured with early detection. We don't say, wait till you got stage 4 cancer and then seek help. We don't do that with any other disease. I don't know why this is being forced on us, but it's un-American. And as far as our American...
It's cruel to people.
People are dying. That's pretty cool.
Dr. Bartlett then explained that even today, if you get COVID and get put in a hospital, you can't have loved ones in the hospital room with you to advocate for you.
That if you get COVID, you get put in the hospital, your family can't be there to be your advocate. I can't tell you how many times I've, as a doctor, have had loved ones in the hospital and they hang something. My daughter was pregnant. They hang something. I say, what are you giving her? It's half in her already. And they tell me, and I said, that's not for her, and it's for the room next door. You don't have an advocate in the room with you.
Here, Dr. Bartlett.
Well, I'm telling you the truth. A family member in the room is an advocate that you are not allowed to have right now.
Dr. Bartlett then took on the issue of the usefulness of masks.
But the decisions that are made that are being forced on us, for 20 years we'd see there's an epidemic in China and we see people walking in the streets with masks. It wasn't working for them then. I don't know why it's being forced on the whole world now, that kind of thinking. Something that's working in Japan and Singapore and is working with my patients, we should be focused on science and facts instead of fear.
Now the conversation starts getting a lot heavier. The lawyer in Debbie starts to kick in, and she is drawing obvious conclusions from the abundance of evidence Dr. Bartlett has laid down.
There's some sort of manipulation toward encouraging America to just wait it out for a vaccine. I don't know if it's the pharmaceutical companies, if it's individuals in power invested in the pharmaceutical companies, but who would be telling Americans we'd rather you die because we want you to wait for a vaccine?
It seems like people are willing to sacrifice others for an agenda. It seems that way to me because we have some solutions already that are working. There's a track record of success by many doctors in Texas. And Texas is standing out compared to other states if you look as far as the survival rate. But
now the moment of truth. How is Dr. Bartlett going to frame this in the mildest possible way and still be true to the evidentiary trail he has just laid out?
You know, I think there is a lot of political motivation behind the decisions that are being made right now.
Okay, well, I do too, and I'm deeply troubled by them because I do, well, you don't have to agree with my assessment, but I'll tell you where my concern is. I think that in the first 5 today, I talked about the headlines and that, panic porn. I think there's a great agenda on the part of some in this country and many in the media that want to keep the economy damaged because of the results of the coronavirus, want to keep Americans afraid in their homes. All of that works against the re-election of President Trump.
Be afraid, be very afraid, because there's a pandemic. Oh, by the way, Debbie, we had a pandemic in 2009. It was the H1N1. And you know what? The flu strain and you know what? The flu strain that's going around right now is H1N1. Our patients that have the flu are having H1N1. We're not focused on that at all. It's not as big a deal as they thought it was. But you know what? I just saw an article that Anthony Fauci's warning us that we might have a new pandemic coming of H1N1 from China. It's already here. That's the strain that's already here. A lot of things that are being spoken, there's a lot of misinformation, a lot of things that are being blown out of proportion. And we have good news today. I'm here to tell you the good news.
I know, it's thrilling news.
Yes.
Then Debbie asked about masks again. In short, Dr. Bartlett thinks masks don't work.
That's what they did in Italy in over 30,000 deaths. That's what they did in France, over 30,000 deaths. That's what they did in Spain, 30,000 deaths. In New York, parroted that, 30,000 deaths. Let's go with a winning strategy of early detection and early treatment with a winning strategy of a successful treatment. And that's what we have. We have an effective treatment that's cost effective, readily available at every pharmacy.
What's not to like about this treatment strategy? And what about that Dr. Faustus catchphrase that none of us will remember a year from now, social distancing?
You know, if you look on the internet, you'll see in Japan, they're still crawling all over at each other at sushi bars, acting normal. And they have less than 1,000 that have died, over 121 million people. This social distancing thing is not what is saving them.
Dr. Bartlett then tackled the big brother effect of the government controlling all aspects of your life.
When you have the government saying, I know more about what's good for your health than your doctor who knows you and your family, that's socialism. That's communism.
Yes.
And that's what we've seen not be a good idea in China. We were all in horror watching the apocalypse happen in China. People were dropping in the streets. Everybody saw that. And then we saw it, the wave spread across Italy to France to Spain and then to our country. And you know, the strategy they were using is the same strategy they're still recommending, and now fining people possibly for not wearing a mask and social distancing. That strategy didn't work in any of those places, but we have some winning strategies that are working in other parts of the world.
Debbie then asks Dr. Bartlett another important question.
Well, the other question is, would there be a need for a vaccine then?
No. And is there a need for a vaccine right now with the same pandemic in Taiwan and Japan, in Singapore and Iceland? Iceland's only had 10 die during this whole pandemic.
Right.
And
That's
so
let's
talk about the vaccine for a second, Debbie.
Yeah.
This is information people need to know. This is a rapidly mutating virus. In Iceland, they broke it down, the DNA of the virus, and they found 243 mutations already. And that was in April. But that's all right. We have an answer for it. There's several ways to treat this. I'm not scared of COVID anymore. Nobody else should be scared of COVID either.
I would not either. Go ahead.
You should not be scared of COVID anymore. I'm telling you, don't be scared of COVID. There are some ways to treat it. If your doctor won't treat you, find another doctor. But we're in America, and there is a solution. There's several solutions for this. I'm talking about one of them. Rapidly mutating virus. A vaccine's not going to be the solution. This is a coronavirus. It goes around every year, the common cold. We get flu vaccines every year, and at best it covers 40%. And so that's not a 100% success rate, and you have to get it every year. If they're going to make this vaccine, it's not going to be a one-time shot
that was my
that will
last
cure
question.
you. And by the way, the people like Anthony Fauci and Birx who brag that they've been working on a vaccine for AIDS for 40 years, and they have not been successful because it's a rapidly mutating virus, parallel to what we have now. So misinformation is out there being sent to doctors right now that we're not worried about a vaccine being made because this isn't changing much. The fact is that they're not going to get, unless they do some research, 243 mutations in a study in Iceland already. And so you're not going to be able to get a handle on this and make a safe, effective vaccine. Let's talk about vaccines in general, Debbie. When they had the race for the polio vaccine, Polio, An American Story, is a book that's out in 2005. The author was our keynote speaker for the Texas Medical Association, and he explained that thousands died from the vaccine. and tens of thousands were paralyzed or debilitated from the vaccine.
Yep.
We don't want to speed at warp speed towards a vaccine and force it on the American people when we don't, first of all, don't need it, and secondly, we need to make sure we don't miss any of the steps that prove that it's safe. And the beautiful thing about the treatment that I'm using is that no matter how many times it mutates, it's universally going to work because it decreases the inflammation. It's a respiratory anti-inflammatory solution for a respiratory inflammatory problem. And I've had people go through many adventures. Each person's COVID story is different. But thank you, Jesus, all of them have lived. None of them have died. And I am ecstatic. I would think that any American person would be excited about it.
I'm still reporting from just outside the citadel of American freedom. Good day.